If you're having a stroke, you've got 90 minutes to get your service. If you're in Russellville and you get EMS here and then we send you to UAB, you're not going to be in the window. We were transferring about 30 patients a month out of our ER, and that's not what you want for a regional hospital. So we need to be able to provide those services here for brain attack. The deficit was easy to notice, and the vision was to get neurosciences where we already were with cardiac.
This was like a building process for us from the ground floor up, because we didn't even have a neurologist to start with, so it was quite a challenge for our hospital.
So when we started building the stroke program, the weakness in this area and also with the staff is that stroke has never been looked at as an emergency. So that was the big barrier to have to work with, is to change that mindset.
Well, since I came here to the organization back in 2014, I took the lead in the role of getting the pieces together for assembling the team to manage the stroke patients. It involved not just the hospital, but it involved the people at the scene, the paramedics, the family, or anybody who recognizes those symptoms. That way we can activate the system, and that way the hospital can be ready to receive those patients.
One of the things that we did was implement an EMS to hospital and ED, more or less, program where we brought patients directly from the street via EMS to the CT scanner, almost bypassing the emergency department with great communication during the entire time.
Once we started putting the pieces in place, then at that point we had to start communicating with the community to let them know that this was the direction that we were going.
One of the greatest things about ECM and their sponsorship with us is they truly understand the importance of educating the community around the symptoms of a stroke, because we know that time is of the essence.
When you look at research, stroke doesn't start at any certain age. So we decided that we were going to start in school systems as young as pre-K and start educating them, because number one, they need to know what to do to prevent a stroke, and number two, they need to know what to do if their parent or caregiver or grandparent has a stroke.
In putting together a marketing plan for our new program, we took several different routes. You just could not share it enough. Using the multiple outlets that we had available to us, not just taking one medium and saying this is how we're going to share our story.
With the young children, we did a coloring contest, and for the older kids, they actually had a drawing contest. We were surprised by some of the ones we got back, because some of these kids had already been affected by stroke and they knew what it meant.
We already were seeing success with social media, so we used that, and it was really a strength for us. Of course, we use newsprint, because in our area we really don't have a lot of local television coverage, so we depended pretty heavily on the print media. But the other area that I think was so successful for us was just community awareness. We took every opportunity that we had.
We came up with From Start to Finish for our race name, because we have From Start to Finish Stroke Care.
We have produced fast letters that we have moved around the community this past year. They're really big, they're red, they're bright, people notice them.
We also felt it would be important for us to establish a relationship with a local not-for-profit, and we selected the Northwest Alabama Reading Aids because they were already assisting with re-instruction of patients who had suffered a stroke. And through that association, we were able to create a local support group, which just gives us that much more emphasis within the community.
We had the softball tournament, and we included all EMS, local hospitals, anybody who wanted to participate. We even had a team from the community. And while we're doing that, we're all building those strong relationships. And when issues come up or when we see areas we can improve, then we work together to do that. So it makes us even stronger in the long run.
It was just one event after another event after another event. And now we see the fruits of our labor when we hear the arrival of a stroke patient.
Coach Stroke ER, Coach Stroke ER, Coach Stroke ER.
It kind of makes you smile when you hear that, knowing that was business that was leaving our area completely and now that business is coming to us.
We are so proud of what ECM has done and their strive for excellence around stroke care. We started out bronze, moved to silver, and this has not happened overnight. ECM was recently awarded Get With The Guidelines Gold Plus certification in stroke care.
All the certifications matters a lot because obviously we have gotten it for a reason because of the steps that we have taken in improving the care. But now that we are a certified stroke center, a primary stroke center, it means even more. We have gained that assignment and that certification because we have shown that by activating the system and involving all of the staff, we can improve the outcomes of the patient, and we have the facilities and we have the expertise and the availability to provide therapy soon enough.
Well, it's really created an environment where we are the stroke center of excellence. We are the stroke center. So patients from all around us are being directed here to our emergency department. And I'm proud to say that here at ECM we have become truly experts in the care of stroke.